Hello, my name is Matt Sion. I'm one of the pulmonologists here at ACMH. Today I would like to talk to you about low-dose CT scans and the new lung cancer screening. Lung cancer still remains very common in the United States. It remains the leading cause of cancer deaths, outnumbering cancer deaths from prostate cancer, breast cancer, and colon cancer, all of which have screening modalities in place. Overall mortality at 5 years with lung cancer, it is at about 16%. In stage 1 lung cancer or early lung cancer, 5-year survival is around 49%. However, at stage 4 or very advanced lung cancer, 5-year survival is less than 5%. What this tells us is that it is imperative that we find a way to diagnose lung cancer at that earlier stage in order to save lives. To date, the screening mechanism of choice was chest x-ray. There has been many studies that have concluded with a very, very large study in the past couple of years that have shown that chest x-rays do not decrease the mortality, or they do not save lives by screening for lung cancer with chest x-rays. In 2011, there was a very large study called the Lung Cancer Screening Study, which looked at using low-dose CT scans versus chest x-rays for screening for lung cancer. This study looked at high-risk patients who were chronic smokers of a certain age and either were still smoking or had quit within the past 15 years, and compared that to the similar patients with chest x-rays. And what they found is there was a significant reduction in mortality in those patients who had the CT scans. There is a large difference in the mortality benefit between the low-dose CT scan and the chest x-ray patients. This was of about 20% per year with the low-dose CT scans. With the general population in the United States and the number of smokers, this would equate out to over 12,000 lives saved each year through the screening mechanism. One number that we look at when we look at screening tests is number needed to screen in order to save a life. And with the low-dose CT scans, this came back at about 320 patients needed to be screened in order to save a life. When we compare that to mammograms, this is a striking difference. As with mammograms, it is 1,200 patients need to be screened in order to save a life. So already we're seeing that this is a very, very good method of screening for lung cancer in order to provide a mortality benefit. The mortality benefit of 20% was found in cancer deaths, but also there was found that all-cause mortality, meaning dying from any other cause besides cancer, was also decreased at about 6.5%. You may be asking yourself, do I qualify for this lung cancer screening? The general requirements are specific age requirements, smoking years requirements, and if you are a current or a former smoker. I urge you to contact your primary physician to go over these in more detail to determine if you are a candidate. The screening process is fairly simple. There is no blood work done. There are no invasive procedures done. It is simply a CT scan, which you would come in as an outpatient and have done within an hour, and then you would be able to go home. And within a week, you would have a report from your primary physician that would give you the results of the test. As a pulmonologist, I deal with patients who smoke and have lung cancer every day. With the lung cancer screening, it is often that we will see patients who have abnormalities on their chest CTs, and then we help to coordinate a plan of care with those patients, whether that involves follow-up CT scans, biopsies, or other treatments. As I had mentioned, low-dose CT scans have been proven to save lives. You may ask, what are the next steps following your CT scan? The most common follow-up is that you will have further CT scans, potentially a year down the road. Some patients may require more frequent scanning. A small minority of patients will require more advanced procedures. Some of these may involve special CT scans known as PET-CTs. Other patients may require more invasive testing, such as CT-guided biopsies or bronchoscopies with biopsies from inside the lungs. It is a relief that we now have a screening modality that will help us to dramatically affect the lives of our patients with lung cancer. By using low-dose CT scans, a very simple method, we'll be able to save lives.